Welcome back to the Nutrimedical Report. Joining me this hour, Jonathan Rothschild, a colleague for over 30-some years, and developer of ecological formulas, cardiovascular research. And Jonathan, let's go down through some of the remarkable formulas that you've developed over the years. What I think people should realize is just how the body is a biochemical maze of different chemical reactions. The best way to think of every cell is a quantum computer. And the chemical reactions are actually secondary. The first is plasma physics, which is charged molecules that send signals to turn on and off genes, and regular epigenetics through things like messenger RNA and various complexes. And the neat thing is that every cellular process is dependent on minerals, is dependent on energetics. The level of biochemistry that's taught to medical students, even naturopathy students and people into herbal medicine, is pretty Mickey Mouse. And as you've been, and I have, even though I'm a biochemist, I've to a great extent been self-taught, because I've been using research labs for more than a third of a century, long before they even set up like Genova Labs, Metametrics, Doctors Data. I was doing tests through university laboratories for my patients. And what I discovered is that by and large, doctors are incredibly poor scientists. They're also very bad businessmen, as you said. They probably all should have quit when Obamacare came in. And I belong to the Association of American Physicians and Surgeons. What we're dealing with is, if you want to get to the bottom of a problem, you actually have to start figuring out what's wrong with your particular patient. And everybody's genetics, their toxicology, their nutritional status is different, and their specific needs, although there's certain common patterns in North America. Massive deficiencies in things like magnesium, methylation pathway disorders. One of the primary pathways for detox is methylation. If you look at populations over, say, that have hypertension, they have inflammatory fatty acids in their diet. They're having, canola oil, which is, rapeseed, soy and peanut, etc., that are pro-inflammatory. Their energetics of their mitochondria is shot, and that's why you develop new mitochondrial formulas. You have, of course, the BH4 biopterin, which is now called pteridin, which is a takeoff of the word butterfly, because this is a genetically engineered bioidentical butterfly form of the BH4 biopterin that works not only in the brain to convert amino acids to neurotransmitters and correct depression, but also in the blood vessel walls to allow the production of nitric oxide, along with other nutraceuticals like our special supernox we have developed in Cardivite. So, Jonathan, let's go down through all the different amazing formulas and look at what we can do to try to help people to re-achieve their biochemistry. And the problem is, you see, it's not just a matter of saying, well, it's a problem where conventional doctors are not doing anything. Even the what I call the functional medicine doctors are kind of scratching the surface. I often, if I go to these seminars, I skip most of the major seminar sessions because they're introductory for 95% of the audience. And they're teaching the same basics over and over again. You have to go to the pre-course or after-course days, where you get with a small clique of doctors that really understand the simplicity and the complexity of what's going on. So let's start off with the top of the list. I'll go from A to B and C. First one is bladder control, which is a really big problem with hyperactive bladder symptoms. We not only clear the pathogens out with our things like our allicin med, Alamax, and Nutridyne, and etc., but you want to reduce the neurological overactivity, and you've got a product that's really good for both men and women called Bladder Up. So tell us the origin of this, and of course I think it has other positive effects, especially on men and prostate, and on women that might have even low-grade infection from E. coli or interstitial ureaplasma ureolyticum, which is a very difficult organism to culture. So if you ask the doctor to culture it, they're just not going to unless you're an infectious disease expert, and you actually put a catheter into the bladder and pull it out and put it into special media. You're not going to find this. You can scope the bladder and look at it and say, oh, that looks like ureaplasma because it has a specific pattern. But most doctors that don't have this background or knowledge, they're just not even going to try to even identify that there's a low-grade chronic infection with something like a bacteria or a copathogen present in that or any other tissue. So let's talk about Bladder Up first, and then we'll run down through all the other amazing formulas.
How much I liked your analogy to the body, the human body, as through a quantum computer.
Right.
And there are now some new quantum computers. I was just in British Columbia near Burnaby, there's a company called D-Wave that actually has developed a quantum computer. And you need a quantum computer to figure out the complexity of all the different, not only the biochemical pathways in our genetic imprint, but the individuality as well. And you're right. Medicine is a crude science the way it's practiced, and they don't go through differential diagnoses. So I'm speaking philosophically before we go on to indications and products and that sort of thing.
Exactly.
And
it's also
the perfect analogy that you mentioned.
The other thing is
quantum computer is maybe 1,000 times more powerful than what we'd have in a server farm where you have all stacks of computers just juggling numbers. And it has to be stored in extremely low temperatures. So going to the Bladder Up, the ingredient in there is pumpkin seed oil. It's something that was known by the First Nation Native Americans for years. Here is an example where Western medicine thinks they have a monopoly on the way people are treated, but there are things in folk medicine that can be more efficacious. And instead of working and tricking the brain with an anticholinergic drug that says, okay, you don't have to pee, and we will trick your brain into doing that, you can have something that will actually soothe the bladder wall so that you don't feel that urgency, and that's what was found in pumpkin seed oil.
Yeah, I know, it's amazing. And of course, when you use anticholinergic in the brain, you interfere with neural pathways for the hippocampus for memory retrieval. You have all kinds of anticholinergic effect on other body systems. And one of the sine qua nons of, quote, modern pharmacology is to create a drug that blocks a certain receptor or pathway, which I think is crazy. It's the example of the recent lawsuits now in big legal firms going after doctors and health institutions and insurance carriers that push HMG-CoA reductase inhibitors, Lipitor, Zocor, Crestor, that now are proven to cause diabetes. Proven. So this is not a guess, and this is not for you smart, alecky doctors out there that think you know better than Dr. Deagle. You don't. Now, that might seem like in your face, but I'm sick and tired of people who pretend, whether they're specialists or not, to know better. When you can read the actual literature published, and you can actually read the medical legal literature and lawsuits that are ongoing right now, and when you take something like Bladder Up, there's no side effects. If you're taking something like carnosine, which is the next supplement we're going to talk about, one of the things that we do in medicine is we chase the blood sugar. We don't even look at blood insulin, but we chase the blood sugar because of glycation. When usually what's called advanced glycosylation end products, which are sugar molecules, if you want to reduce those, you take things that are anti-glycating, like fat-soluble thiamine, which is the allothionein, and carnosine, and things that will recycle the antioxidants, like our long-acting alpha-lipoic acid, Nutraceuticals. Let's talk about carnosine for a minute. It's also, by the way, a cousin of a product we carry called Can-C. In my new IC formula, which I'm working on with a company out of Phoenix, will have not only the dimethylcarnosine, but a number of other molecules in it that will work to protect the eye, because ultraviolet light's higher, oxidative stress is higher from cell phones, and increased toxic load in the population, and basically people are incredibly deficient in things like selenium, which, by the way, you have one of the best selenium cruciferate, chromium cruciferate. So let's talk about carnosine next, because the doctors are more than willing to slap people on drugs like metformin and glipizide, which has all kinds of side effects, and some of these other diabetic drugs, but they don't want to reduce glycation as the first step, rather than just chasing their blood sugar like a mouse after the cheese.
Well, you can't have a cookbook protocol for diabetes. First of all, it's growing exponentially, and it's not so simplified so that you ignore end product glycation products, as you mentioned, and just try to suppress insulin in its own way. Diabetes treatment is perhaps one of the most primitive protocols that you see in modern medicine. But when we talk about carnosine is a singlet oxygen quencher. It means it's an antioxidant that works on unpaired.
Welcome back, and next up, besides the carnosine, carnosine is really important. That you were just finishing up that statement. I want you to complete that, Jonathan, because I tell people if you're diabetic, and it's not just diabetes, When I did my original research with Dr. Otto Hewen, the head of pathology at the University of Calgary, 1980 to 83, and I mentioned this on the show before, which is why I haven't published a lot of this stuff. I'm going to start publishing it because I got persecuted. I realized right out of the gate, and I was prepared to finish my marine bacteriology PhD thesis at 21, just write the thesis. My grandfather was dying of diabetes, so he wanted me to go into medicine to find the cause. So when I had to work with the head of pathology, the response was, when I brought my research to the Ron Curry Diabetic Research Institute at the University of Calgary, the head professor there, Dr. McEwen, freaked out. I mean, it was like being on the set of The Exorcist. And,
Dr. McEwen?
Dr. McEwen.
Is that Ian McEwen?
It is indeed.
I remember a Dr. McEwen.
Right. Well, he's a real person. He's not one that I made up in my head, even though a lot of people think I'm psychotic. I'm psychotic because I claim all these things, but it really did happen. And that's not the only thing. I mean, I've had serial discoveries, like a magnesium I sent to the Advanced Cardiac Life Support people back in 78. They had Dr. Eisenberg, the head of the research facility, University of Washington, Seattle, when I was doing my work as a resident in family internal medicine. The problem is that it comes back to something like carnosine. What we discovered is that elevated blood sugar is bad for you. Elevated blood insulin is also bad, but even worse in ways that people don't know. And a lot of people, long before they ever get blood sugar, maybe they only have hypoglycemia and they've got normal glycemia, they still may have 3 times normal insulin. Insulin elevation is not good either. And if you actually look at our whole entire population in North America, we're all hyperinsulinemic. We've got, and it's pro-inflammatory. It's pro-vascular endothelial growth factor for growing abnormal endothelial or capillary vessels in the back of the retina of the eye, which is part of the reason why we're seeing a massive explosion of diabetes and circulatory issues. And pro-inflammatory to increase things like C-reactive protein when your insulin level is elevated. So when you take things like carnosine, so doctors are chasing the blood sugar, when really it's only a minor pathway. What you have, the reason why blood sugar is elevated is because your resistance is primarily in your skeletal muscle, to a lesser extent in your liver, and the least in your fat cells. That's all been done by glucose clamp tests, cell cultures, and everything in advanced research labs. So carnosine is really important. The next one is, of course, chromium cruciferate. Now we have our Vitamin Mineral Max and Minerals Plus, but if you want to add additional chromium, this is developed at Johns Hopkins University, and you get, I call these orphan nutraceuticals, which are pretty powerful. Diabetics and pre-diabetics, means a good part of the whole population, in fact, can't hold on to minerals that help to reduce insulin resistance. And insulin resistance basically is you're not metabolizing fatty acids properly, so it shuts down the proper signaling for the insulin receptor. Leptin resistance, which is why we have things like our leptin metabolic and diabetoline and biotin plus, but chromium cruciferate. Let's talk about this for a minute. Chromium is very important for the GLUT4 transporter in your cells, and we try to optimize it with things like getting the best forms of chromium, and then using things like indiamines, which is 49 in the periodic table, to get it inside the cells and tissues, because the diabetics have low magnesium, low chromium, low vanadium, and those are just minerals, let alone the fatty acids. Their fatty acid metabolism is all shot. So that their fat tissues, even years before they ever turn diabetic, they get little microglobules of fat in their muscles, even if they're ideal weight and they're athletic and have totally normal blood sugar. So when doctors are looking at the cause of diabetes, the reason is they aren't really interested in the science of it because it confuses them. That's the problem. When really it's actually pretty darn straightforward. And chromium cruciferate is part of the answer. Not the whole answer. I don't believe in the word cure. Cure is a stupid word that shouldn't be used by doctors. Even if you live 10,000 years, you're going to be hit by a gamma burst from a star cluster 45 light years away or something, or a meteor impact that's going to be near your home. So the fact is that we're going to extend your life, and we're soon going to hit what we call zero senescence, which means if you're real careful, you don't believe in extreme sports, you could live 1,000 or 10,000 years. But it's going to require optimal biochemistry, optimal free radical control, and optimal cellular metabolism. And it sure as hell is not going to be saluted by doctors giving you 50 drugs instead of 10 drugs. So let's talk about chromium cruciferate. I think a lot of people
are so concerned about the quantity of life and their life expectancy, they don't realize that if you're not healthy and you don't take care of yourself, you're not going to have a good life in your later years.
Well, we have what I call age extension rather than life extension rate. Now, the doctors, as soon as we had cardiac resuscitation units, which we didn't, by the way, have in the 60s, they really developed in the 70s, we would take people back from the dead, and then we bypass their arteries, and they'd live another 5 or 7 years, kind of trundling along. And now we have a lot of drugs where, to be honest with you, I think they make people old before their time, and then they, quote, prevent them from getting what I call the full state of diagnosed death, although they wish they were dead sometimes because they're on so many polypharmacy. One of my geriatrician friends says he keeps deducting drugs until the patient can recognize them. But we have chromium cruciferate, then we have, of course, cytidine choline to get the brain going again, and it's part of the DAN formula put together for autism, but also for dementia, which is cytidine choline, allothymine, or fat-soluble thymine, and uridine monophosphate. Let's talk about this triad for a minute, because people don't realize the cholinergic pathways regulate memory, the Furcard valve system in your brain, and it's pretty straightforward. You've got to reduce free radical reactions in the brain. You've got to get rid of free iron, which we do with our Minutra defense. You've got to chelate out the heavy metals. You've got to restore the phospholipids in the brain in order for it to remyelinate nerve fiber pathways because they've been dysmyelinated. And if people don't believe me, you can do a QUIG or quantitative EEG, a SPECT scan for blood flow and see the Swiss cheese hypoxia, or you can do a positron emission tomography scan and see the brain is not working because it's not turned on. The lights aren't on. And so when I hear people say that somebody's got Alzheimer's, I said, that's a ridiculous diagnosis, because the only way you can prove Alzheimer's is do a brain biopsy, and I don't see anybody lining up for it. So when doctors talk like that, they're lazy. They don't want to do the test to find out why someone's brain is not functioning. Maybe they're over-medicated and their body can't even detoxify the current drugs that they're taking because they're sedated so much on antidepressants and antipsychotics and electrolyte problems and cholesterol-lowering drugs that their brain is dysmyelinating. They can't actually connect their neurons. It's like, doctor, they're dying of what I call MD disease. Massive drugging. How's that? That's
that matches the M-deity syndrome.
Yeah, well, I call it magnificent deity, more dough, and massive drugging. And people say, oh, Dr. Deagle. I remember we had a big scare, and this is about, 20 years ago. And we had I was doing family internal medicine in Colorado, and we had an antihistamine that was actually metabolized, so I think it was 3A, it was a 3A4 cytochrome metabolizing drug. And it was metabolized the same as a cardiac drug that was getting real popular. And if you took this antihistamine and you took the cardiac drug, your cardiac drug dosage got so high, you went into permanent heart block and you basically cardiac arrested. So if you happen to take this antihistamine and their doctor decided that he was going to give you this whiz-bang new cardiac drug, adios, amigos. And it was only after a certain body count that they found to say, oops, it's going through the same cytochrome system in the liver, so the blood levels were being off into orbit. Interesting, hey? And we're back with Jonathan. Jonathan, let's talk about your formula you put together, which is allothymine, fat-soluble thymine. This is a really big deal because, and we talked about the story many times, but it was an interesting story that during the Japanese occupation of Hong Kong, and they went back to brown rice, the Hong Kong Chinese children didn't have any sudden infant death syndrome, because the immature development of the respiratory drive center and the pons and the brainstem was causing them to have death. When they went back and received the fat-soluble thymine, which is in the brown rice, the sudden infant death syndrome disappeared. It didn't happen. Also, neural development. For example, if you have a child with Down syndrome, or if you have somebody who's developing, quote, dementia of some kind, I like to use the broad term rather than saying it's Alzheimer's, which is stupid. It could be a combination of vascular hypoxia, inflammation of the brain, activated viruses from simian virus 40 that they got in the measles, mumps, rubella vaccine, or heavy metals they're eating in their cereal. Or drinking in their water. It could be all kinds of stuff converging to cause a problem. So tell us about cytidine, choline, allothymine, and uridine monophosphate. How do these work to increase... Well,
cytidine, choline, and uridine monophosphate belong to a category of nutrients called cyclic nucleotides. And they are very important in structure and function and mitochondrial metabolism, and they're ignored. I mean, they are as important as vitamins and minerals.
Right.
And yet we don't see them in too many nutritional supplements. So if you look at the literature, you'll see that there's a functional role for these particular nucleotides. Cytidine, choline. Well, you know, choline has always been associated with supplementation for memory, and in Spain and in Europe, they found that the cytidine choline was the best carrier across the blood-brain barrier for getting choline into the brain and affecting the firing rate of what they call cholinergic neurons. Earlier in this show, I was talking about the pumpkin seed extract as an alternative to bladder drugs for bladder control, and the bladder control drugs, the prescription items, and even some of the over-the-counter ones, they affect acetylcholine. So it's interesting. We're going full circle. I'm not rambling. I'm talking about how some drugs will actually deplete acetylcholine to trick the brain into thinking that you don't have to urinate, and that has a side effect cumulatively on affecting brain function and memory. So we want to use cholinergic agonists, especially when we age, not cholinergic antagonists, and the best bioavailable form is the cytidine choline.
I take it every day, and I can tell you, if you're trying to do brain protection, you want things like DHA, docosahexaenoic acid, cytidine choline, L-thiamine, uridine monophosphate. You want things to repair the phospholipids of your brain, and you want things to downregulate, like selenium cruciferate, downregulate the free radical peroxynitrate and hydroperoxy radical that are going to cause a microglial, the immune cells in the brain, to chew up your astrocytes or your neurons, or stop them from firing so you get astroglial inactivation of neural networks. So, I mean, this is all just what I call neuroscience. And when I talk to doctors, and I consult with doctors every day, if they will approach me, a call, I will provide them a free teaching session anytime or just ask them questions. But what I find is the training in medical school, the training in residency is abysmal. And I'm not talking about just some medical school. I'm talking about all of them across the entire world. The only place where there's any exception is where you get advanced programs where you're in a PhD program at, say, Mayo or at Harvard or whatever, and you're sequestered in a lab and you're one guy and nobody reads your research, even if it's published in Circulation or Neuron or some of the medical journals. The other doctors have no idea whatsoever you're talking about, because you've got now a PhD type in a medical degree program that may be a cardiologist or a neurologist, but the other doctors don't incorporate in practice at all. It's disturbing. It's like, wow. I mean, so I'd say the first thing is no one should get into medical school or naturopathy school unless they have a master's level at least of a hard neuroscience of biochemistry, toxicology, etc. I really don't understand how people think that you can know a few herbs or a few drugs or surgical procedures and all of a sudden call yourself a health professional. You're a fancy health technician. A health professional is a scientist that problem solves and may have technical skills or can use technical skilled people that can be trained up in a few weeks or months to do something. But it requires a lot more brain power to figure out what's wrong and what you have to do, like a general contractor, than someone who knows how to lay tile in the bathroom. It's the same kind of thing.
Yeah, I think that cookbook approach to medicine really has to change in the education of the physicians.
And it doesn't take a lot more time either. If I do a cardio-ion panel or a functional medicine test, and someone tells me, and I do the consults now free since 2008, I can tell them in a couple of minutes exactly what supplements will help, and I can do QRMA tests on, or functional medicine tests, or intracellular minerals, or organic acids, and I can tell them if they're making progress toward fixing the biochemical physiopathology of their cells to actually reverse and bring them into a state of compensation. So, for example, we're talking about diabetes. There's a problem with insulin signaling through serine and threonine phosphorylation of the insulin receptor. It's called the IRS1 complex or substrate. Well, how many doctors know that? How many doctors know that there's some problems with signaling when, again, it all dies with phosphorylation? And by the way, it's all signaling through things like these molecules you're talking about that regulate DNA and RNA and cell signaling inside the cell. That, like, you're kidding, cell signaling is important? Yeah. That's what diabetes is you get insulin resistance decades beforehand, and why insulin elevation is in many ways more toxic and more dangerous than elevated blood sugar. So that gives people an idea that this is not just, that's what we think is happening. Why do we have a massive explosion in obesity? Because we have massive explosion of pro-inflammatory fatty acids that increase insulin resistance, decrease fatty acid problems. We have heart disease because we have oxidized cholesterol and fatty acids. And you've got some nutraceuticals to actually reverse that, to actually say, how do we fix that? Well, let's look at things to prevent cancer. You have ellagic acid, and this will not only repair DNA, but it also helps promote cancer and precancerous cell death, so it goes through programmed cell death or apoptosis. So let's talk about ellagic for a second, and then we'll move on to some of the other amazing formulas, because I put this in our cancer protocol. Everybody that is going to be preventing cancer or trying to fight cancer, and we give them a much higher dosage, they need to be in high-dose ellagic from Terminella chibulia.
Yes, it was originally isolated from strawberry leaves, but we found a much more potent source of ellagic acid from the Terminella chibulia plant. And it was very interesting the way you talked about cancer cells. These are immortal cells.
Right.
That
survivor cells. These are special ops cells. They're special forces cells that basically said, hell no, this is not a conspiracy theory. I'm going to get body armor on. I'm going to develop my home weapon systems. You coming into my perimeter, I'm going to kill you. I'm going to metastasize and hide from the immune system like a roving, one of these.
Well, it is a battleground.
It's a battleground, and it's a genetic disease. But people don't want to approach cancer as a genetic disease. They want to clobber it like a commando bringing in a flamethrower, when it's like, that's not what cancer cells are. They're surviving cells.
Right.
And there's also, for every cancer cell, there's what's called a cancer stem cell. So when someone says, they cut my cancer, I said, no, you got cancer stem cells that you've been exposed to chemo or radiation. You make your cancer stem cells 30 times more radiation and chemo resistant to the previous treatment you had. And if the cancer reemerges, it's going to be a real monster. So ellagic acid, if you want to prevent cancer, this gently tells the cancer, let's just repair and become normal again. We'll send the cancer cell the right literature. Or, you're so damaged now it's time to just go and die. Commit harikari, the Japanese art. Back in a moment. Welcome back, and I guess I philosophized a bit, but I think it's important. I want to run through quickly some of the other amazing nutraceuticals, and I'll just do a quick tiptoe through them. Ferritin, the best form of iron, raises your iron level to iron 3, which won't cause constipation. Forskolin, not only for hypertension and cardiac rhythm support, but also for peripheral conversion of T4 to T3. The best form of vitamin B5 is the royal jelly, which is the pantethine. You've got Her Majesty's royal jelly. Magtaurate, I give it in all our hypertensive protocols. Tauric acid, magnesium, extremely important for cardiac and for reducing vascular spasm because it's the primary calcium ion channel blocker. Menierin for inner ear problems. Microdoses, the actual 100 nanograms of actual human growth hormone per spray, so I recommend 5 sprays before exercise in morning and bedtime. Mitochondria, this is the glycine stabilized ester of propionyl L-carnitine. And of course you have the new one now called IBS Care, which is really good. It's the propionyl carnitine, which I use in all our cardiac people, along with our CoQ10, which is the only non-crystallizing CoQ10 in the world. Mitochondrial catalyst, and this contains a lot of these special molecules. Jonathan, can you talk about that mitochondrial catalyst, what's in it, and why the bio...
on the cellular level with the mitochondria is much more important. And
right.
I came across a recent study in a Japanese journal on the alethiomin, which you talked about earlier, and how it works in fatigue. And
Right.
I didn't even know about this. This is a recent study, I knew that it was neuroactive and that you could find it in unpolished rice, and that eating raw fish, which like sushi, will actually destroy thiamine. So the Japanese actually fortify their flour with it, and yet in very low doses, but in higher doses it can be used for fatigue now. That's one thing that they're finding. For people who have been drinking alcohol and have a hangover effect, that's often from a thiamine depletion. The overt clinical damage is a Wernicke's, which is a total thiamine depletion from alcohol. But we're talking about subclinical issues for people who like to have a few glasses of wine and feel a little under the weather the next day. So this is fat-soluble, not water-soluble thiamine. B1 is the first B vitamin, and it works with the nervous system. That's its main role. But there's other mitochondrial catalysts, such as the uridine and the cytidine choline.
And the riboflavin 5-phosphate, too, which is, the phosphorylated riboflavin, which is really important.
These are all important nutrients, and they're frequently overlooked. You can take a multivitamin, but you're not getting your nucleotides, which are critical.
Yeah, and these are more primary signalers that are going to change mitochondrial function. For example, most people realize that diabetes and most major illnesses have one form or other of a mitochondrial dysfunction, where there's some abnormal, if you want to call it, crosstalk between the regular cellular genetics and the mitochondria. That's what diabetes is. That's what dementia is. That's what heart disease is. That's what Asperger's syndrome is, and autism. That's what a lot of hormonal problems. Most people don't realize even the mitochondria generate pregnenolone. That's the main hormone, along with DHEA, the main hormones that actually are the base hormones for your adrenal glands. They come from your mitochondria. People don't realize that, and so that's pretty interesting. The other neat ones are monolaurin, which you developed that has lauric acid, and it blocks viruses and bacteria. It's excellent for preventing it. So, and then we have Narival. This is a lot of people have what we call very low energy. They may not just have adrenal dysfunction. They may have an actual conversion block between tyrosine. So this is an acetyltyrosine with biopterin. So if I get somebody that's really has low energy, and you can actually test it in their organic acids and their urine too, by the way, at Genova Metametrics. And Narival will reverse that. Then, of course, Posinol, natural mood elevator. We use that along with our pteridine, which is the BH4 biopterin, and semethylacetylmethionine to reverse depression. Along, especially if you give them adequate amounts of molybdenum, manganese, magnesium, and the other cofactors necessary for brain hormones. I mean, people don't realize you need 7 different minerals alone, along with the right fatty acids and things like Posinol, which has been around in Asia and China for thousands of years, and it's the best form of a natural mood elevator, mood stabilizer. And of course, we have a new formula that's going to be coming out. We're going to call it Unbroken Sleep. That'll be coming out in the fall. You have the residual hair tonic. I use it every day after a shower. My brothers are bald. I'm not. It makes a big difference. I've been using it for, probably 25 years. Selenium cruciferate, probably one of the best forms of selenium. We add it on top of our Minerals Plus. And, of course, you have the serapeptase, seroflozyme, Spilkes, which is an anxiolytic, calcium magnesium taurate, muscle relaxant, Sphingolin, which is a myelin basic protein for MS, so we have MS people. And, by the way, there's non-MS people that have dysmyelination. In fact, they did research studies at Trinity College in Dublin, Ireland, about 25 years ago, and they discovered that 3% to 5% of the population have dysmyelinating lesions in their brain. They'd never get diagnosed with MS, but they have it. And then, of course, we have the Swedish flower pollen to stop bladder irritability, which is a natural alpha-1 blocker. Synaptin, we may use along with our Cognition Plus for improving brain function. And, of course, the uridine we mentioned earlier, uridine 300, and the uridine, the form of the triacetyl uridine for mitochondria. So let's talk about some of these other ones in the last couple of minutes, Jonathan.
Well, that's a mouthful of
pick out which ones you want to talk about.
Supplements.
Yeah.
Going full circle, the monolaurin is naturally present in breast milk. It's also in coconut milk, so they're able to use that as a starting material to separate this fatty acid and then esterify it. And you can't just use lauric acid. I mean, it has to be an ester for it to solubilize the lipid envelope coat of the viral membrane. It's used in primary care when people have the flu or viruses or low-level viruses like Epstein-Barr cytomegalovirus. So that's one way of avoiding antibiotic resistance. Very often in primary care, people receive an antibiotic when they have a viral infection and won't do anything for them, and it'll just make them more resistant.
It's amazingly stupid, isn't
littering the microbiologic flora all over the country.
Yeah, it is amazing. Some of my other favorite ones that you put out are the things like the synaptin for brain memory. A lot of people, and of course, this is a very good formula for protecting the brain. A lot of people don't realize that, your doctor may get you to live longer because he's bypassed your heart, but if you don't protect your brain, it's pretty hard to get a brain transplant. And of course, if it would be possible, it wouldn't be you anymore. It would be somebody else in your body. So you got to protect your neurons. And synaptins, things like our Cognition Plus, fatty acids, these are all extremely important to protect the brain.
If you wear a motorcycle helmet when you're going out on the road, think about all the xenobiotics that you're facing, both in your medicine cabinet, the air you breathe, the foods you eat, and you want to take care of your brain. What is life without a good, healthy, functioning brain? Yeah. That's what we get back to, the quality of life, not the quantity of years.
Right, and not only that, if you improve the, what I call, keep people in a state of functional compensation, you'll have quality years, and quantity will just naturally proceed. In other words, you reach what's called zero senescence. At the same time, you have zero toxicity and zero free radicals. They all converge. So in other words, you can't live old unless you live well. You might extend the dying process, but it won't be very long. And, people are all worried about things like Ebola. You can need to build up your basic biochemistry and your ability to compensate. Besides our big, powerful antipathogenics like Nutriodine, Allicin Med, and Ionic Silver 100, you need to boost up your brain, your heart. Things like magnesium taurate. Microdose. If you want to improve your tissue regeneration, that's part of our thing like Collagen Max, Mountain Red Velvet. Microdose is right there. If you want to increase your own natural growth hormone release, you want to increase your energetics, Royal Jelly. Along with the mitochondrial support, mitocarnitine and mitochondrial catalysts. These are amazing formulas you developed, Jonathan, and they incorporate in many of our protocols.